So I think with medial ligament and meniscal injuries and cartilage injuries in your knee, you can't prevent that particular event happening on most occasions. For example, like with a medial ligament injury, it's going to be a block tackle, and you just cannot prevent that. What I would say is, if you're going to go into a tackle, or if you're going to do anything like that within sport, it's important that you go in 50-50 and as hard as you can. Often the times I have seen the injuries when people either, what we'd say, dangle their foot and so literally put it quite loose, or they shy out of a challenge. So if you're going to go into a 50-50 challenge with someone, in terms of that split second, the way of preventing the injury is to go in hard. Because if you go in hard and you go in equal, it's less likely that you're going to damage the ligaments. Reason being that you're actually getting your muscles to tighten and give that joint the support that it needs, and that ligament. Whereas if you allow the ligament on its own to do the action, like in a block tackle, eventually the ligament will just damage itself. So I think from that point of view, it's really important to make sure at that time you go in equally or as hard as you can, and you don't shy away from the challenge. So that's specifically with the medial ligament. I think your quads and your hamstrings will act as guy ropes to that medial ligament and will act as supporting structures for that medial ligament. So it's important that you have the balance there right, and you do strengthening work on your quads and hamstrings. And the same will happen with meniscal injuries and cartilage injuries. It's important that you have the musculature around your knee to give it the support that it needs. And doing proprioception exercises will really help your meniscal injuries, because often they're caused by twisting injuries, and so therefore again, if you've got better proprioception in your knee, as the feedback going from your knee to your brain is a lot more sensitive and a lot better, what you'll find is that is less likely to cause an injury in your cartilage. The only other exercise, and the final exercise I'd use for cartilage and medial ligament injuries, is using a single leg squat exercise. So we use it quite a lot as physios in terms of both the balance element of it and the strengthening element of it. And I think it's quite important to get good form and good posture when you're doing that exercise, and that will definitely help improving the proprioception around your knee to hopefully reduce those injuries as well.